Click and all right, recording has started and we're going to go ahead and start our session. My name is Erica Haller-Stevenson. I am the Violence Prevention Administrator at the Health Department in San Antonio. We may have interacted with each other a little bit yesterday, and I'm just getting the session kicked off for you. The first session of the day here for one of our tracks is titled Building Bridges, Collaboration Within the Community, focused on child protective services and domestic advocacy. We're going to have two presenters for you today, and I'm going to give a brief introduction for each, tell you a little bit about them, and then they'll go ahead and start their presentations. First, we have Christina Campos, who is the Director of Community Integrated Services for Family Violence Prevention Services, Inc. She earned her degree in Liberal and Civic Studies with a minor in psychology from St. Mary's College of California in 2002. And in 2005, she earned her master's degree in education and her California teaching credential for grades K through 8. She held a variety of teaching and management positions in the Mount Diablo Unified School District in Northern California, as well as teaching positions and nonprofit special educational services for both children and adults. She moved to Texas in 2009 and began with Family Violence Prevention Services as a coordinator for the Celebrating Families program. This program is a psychoeducational program serving CPS-involved families. Currently, she serves as the agency, Currently, she serves the agency as Director of Community Integrated Services and the Enhanced CPS Liaison, working in both non-residential services and in the Battered Women's and Children's Shelter. Additionally, she consults on the Promising Futures Community of Practice Child Welfare Group through Futures Without Violence. She is passionate about social justice and advocating for positive change in the systems serving adult and children survivors of violence. Our second speaker is Kimberly Hill, who is an investigations program specialist with the Texas Department of Family and Protective Services. Kim graduated in 2008 with her bachelor's degree in criminal justice from the University of Texas at San Antonio. She went on to become a sexual abuse investigator for Child Protective Services, which I'll call CPS from now on, and was in that position for 7 years before promoting to a supervisor in the investigations division. After her time in supervision, Kim stepped into a community engagement role with the DFPS, where she covered Bexar County, as well as the 27 surrounding counties in Region 8. Her role in community engagement allowed her to oversee the volunteer and internship programs within the region. This position also allowed her to assist the department in building relationships with various community partners and stakeholders. In May of 2022, Kim transitioned back to the Child Protective Investigations in a new program specialist role that was created for each region in the state of Texas. In this role, she continues to build relationships with communities. Thank you for joining us, Christina and Kim. We'll go ahead and allow you to begin.
Good morning, everyone. Thank you for being here with us today. We're excited to present on this collaboration, excited to have the opportunity to kind of share with you what we've been doing over the last 5 or so years together, how it's kind of evolved, and discuss what that can look like in the broader sense within the community.
Yes, thank you all for allowing us to come in this morning. We definitely want this to be an interactive presentation. So if you have questions as we go, feel free to put them in the chat. We will have time at the end as well for questions and discussions, but definitely don't want you to forget anything that you might have. So, you know, when Christina and I, we've been asked a couple times with various conferences to present on collaboration. And for us, it really didn't feel like it's anything revolutionary, the information that we're bringing today. However, when we have presented this before to various domestic violence shelters and CPS liaisons throughout the region here, it was something that we realized does require a little bit more work. And so we're here today, not to necessarily, you know, as the experts on collaboration, but more to just kind of tell you what has worked for us and some different ideas that have really worked in building our relationship and building that bridge, especially here in Bexar County between domestic violence and CPS. So we want to start off today, before we move on to our first slide, we want to ask everybody, what does what would your definition of collaboration be? Or what does successful collaboration look like to you? And if you wouldn't mind putting that in the chat along with which organization you are with. Just kind of want to see, you know, everybody may have a different perspective on what collaboration is.
Also so interested to see who else is joining us today. Like Kim said, we are coming with the mindset and the experience, having kind of brought the child welfare world, the domestic violence world together. We really want to try to make this as applicable as possible for the rest of our audience, right? And recognize all of the various types of collaboration and the individuals and organizations practicing collaboration within our community.
Awesome. So we have working together for the best interest of the parties involved. We've got Child Safe on here. Thank you so much. So they talk about their multidisciplinary team consults between various departments on cases, law enforcement, CPS, attorneys, medical, working together toward a shared goal, working together to support clients in achieving their goals. We've got Center for Miracles on. Awesome. Working together towards shared goals. Awesome. Yes, definitely. Those are all great answers. So we'll go ahead and move on to slide 1, please.
So, and that's exactly where we wanted to kind of start that framework, that what is collaboration? And I think as we look at this kind of working definition here, the action of working with someone to produce or to create something, right? It would be remiss if we didn't really recognize the mindfulness it takes to do this, right? A lot of us feel like we collaborate, right? You have to work with this partner, you have to get information from this person, or you need something from this other organization. It can become so routine. It's just what we do. If we don't have that piece of mindfulness and really being aware, what are we trying to produce? What are we trying to create? Where, are we going? What type of opportunities present themselves when we're able to collaborate with other individuals and organizations? I love that one of the first answers Kim read out focused on, who are we trying to serve? Because when we look at collaboration, we also just really want to have this bigger mind frame of not just the entities collaborating, but who are we collaborating around, right? And so that's, as we kind of sat down to look at this and what are our purposes in collaboration between CPS and domestic violence, right? One of the first things we looked at was safety. Safety for children, safety for families. And then just recognizing when you come from a child welfare world, right, that emphasis, that focus is on the children. When you're coming from a domestic violence standpoint, a lot of times you're working with victims, survivors of violence. You may be working with the children. You may be working with the individuals perpetrating violence. But regardless of who you're working with or what kind of side of that bridge that you're on, when you have safety for parents, right, inevitably safety for children and family is going to follow. So for us, when we look at collaboration, kind of centering on that fact of safety being one of the things that we are trying to work for together.
Yeah, and as we go through this presentation as well, I know some of the things that we're talking about are, family violence in the CPS system, but really this can be applicable to any agency, any collaboration. And ultimately these, for probably most of you joining us, either work with parents or you work with children. And so just keeping this in mind that it's not just for domestic violence advocates and CPS. And one thing that we also, a goal for us is appropriate support for people experiencing violence. For example, we want to make sure that when our caseworkers are referring our clients for services or getting kids involved with services, we want to make sure that they're the right ones. And I think for us, and we'll talk more about this later on, but it was something that we realized was a so-called issue initially, because our caseworkers cannot be experts in everything. So how do we get them the knowledge that they need, but then also connect them with somebody who is an expert in the domestic violence field? And one of these examples is just making sure that we are, for example, our caseworkers a lot of times might think that couples counseling would be appropriate, or anger management for certain domestic violence cases. When in reality, you know, we've done some trainings to realize that they really need to refer to address the domestic violence piece before they can move on to couples counseling, if that is, you know, what the family's desire is to stay together, or marriage counseling. And so just making sure that those clients are connected to appropriate services and appropriate supports.
And to kind of go off of that, just recognizing, like Kim said, while caseworkers can't be content area experts for everything that they may encounter within that child welfare world, right? We have to kind of check ourselves as well. So within the DV world, looking at, I understand why this service may not be appropriate, right? Or where we need to focus on these other aspects of the case. My counterpart at CPS may not necessarily have that same training or education. So how can we, you know, work together? That brings us back to that collaboration piece. And one of the things I think that we were very intentional, and when Texas Council on Family Violence first brought Kim and I together back in about 2018, something they were very intentional about, right, was all of the emphasis that's on victim and survivors of violence, but really also looking at the other piece of that and providing accountability for the person choosing violence. So also recognizing, how are we focusing on the individuals, the behaviors, the beliefs, the generational nature that may have led to a person choosing violence, perpetrating that violence within their family, requiring the need for intervention from child welfare, right? So that was something I think for a lot of people at the table was a new conversation, not just on the CPS side, but again, even within the family violence world, looking at how sometimes we're very victim, survivor focused without remembering there's not a victim, right, without a perpetrator. And we need to definitely be holding space for both and opportunities and ways to work with both.
And, you know, ultimately, we do both want successful outcomes for families involved. Many of the domestic violence victims do, you know, have a case within the CPS system somewhere. And so maybe that looks like keeping kids out of care. Like, how can we work with our counterparts, maybe if mom is at the shelter, in coming up with plans or ways that would prevent us from having to take custody of these kids? Or maybe it looks like brainstorming some out-of-the-box safety plan ideas. And so really just ultimately, again, what is a successful outcome for that family and how can we work together to achieve that? All right, so slide 2, please.
So with this, we really also wanted to look at deeper impact. I think Kim's going to lead off here, but again, just back to this idea of there's collaboration on a very surface level. It's something we do day to day, but when we're really wanting to create deeper impact, it's going to go beyond just, again, that surface level or a general connection between one person or another, and really be integrated throughout the organizations, the departments, the systems that we work within.
Yeah, and you know, we are just one person. CPS is a huge agency. You know, the domestic violence world is huge. And so we are only one person. So ultimately what we want to do is train each of our staff to feel knowledgeable about working with each other, to where we do not always have to be the one go-to person when there's a question or a consult about a case. And so we're going to talk here in a little bit about ways that we've done that, but really helping grow staff relationships between our agencies, rather than just a relationship between Christina and I.
And again, by identifying those areas for learning and growth, it really is going into what we've learned working with each other, but then also taking that back to specific departments, looking at the teams that we collaborate with, not just the teams maybe personally or frequently, right, but the other areas within the department, within family violence prevention, right? The individuals we work with. That way we're creating these mini collaborations, and there's less dependency. Again, like Kim said, we're just two people in huge organizations, right? But by identifying those areas for learning and growth, recognizing the strengths, what we can build upon, and perhaps also areas where there may have been some struggle or some misunderstandings previously, where we can kind of work through those things to get people on the road to more meaningful collaboration.
And one of those really important things is being able to communicate in a productive manner. So, when those areas that, again, may be identified as so-called issues that are really an opportunity for learning and growth, being able to communicate that within your organization to the other in a productive manner without being defensive, and really just being open-minded and, okay, maybe there are some areas that we need to improve in. We are all not perfect. We are not experts in everything, as I mentioned earlier. So how can we, rather than identify this as an issue, how can we move forward in this manner? But it is, having that idea of just being open-minded to maybe some issues that are going on within your own agency.
And then taking that communication to the next level. Again, really recognizing, especially in the context of what we do with CPS, what we do with family violence, we are only two pieces of a puzzle. The other part of that equation is going to be the individuals we serve. So partnering together with survivors, having them be able to share their voice, recognize the needs that they may identify, with all well-meaning, right? Anyone working within the child welfare DV world, right? We're still coming with our own biases, our own perspectives, our own experiences, which may not necessarily be those of the people that we're serving, whether they're survivors or even if they are the people choosing violence, right? And so by being able to create space, allow the voice of the people that we serve to be heard, right? And come to the table to be part of this collaboration, we're going to end up with more meaningful impact. We're going to end up with more success with our outcomes. And sometimes, again, we may have to look at those outcomes that we have kind of worked for or identified, right? Maybe not necessarily the same way that a survivor might identify a successful outcome. So being able to really work together, center back on who we serve, and look at how true impact, right? And even that cross-training can be informed by looking at the community that we're working within and the people that we're working with. And next slide, please.
So what does that look like? So now really taking those collaboration and those ideas and putting it into action. And again, as we mentioned earlier on, this is specific to things that we have done together. However, you can take out the CPS part or the family violence part and insert your own organization and whatever organization you're trying to collaborate with. And these are just some ideas that have really worked for us. So we started doing presentations for family violence agency staff, not only for their program staff, but we've also brought in leadership when there are changes within the agency. As we know, CPS is constantly changing, policies are changing, legislation is changing. And so if we aren't able to communicate that to our community partners, sometimes there is a lot of miscommunication and misunderstandings. So we have gone in to do things like that. It's same for the client. So for example, we were having, Christina reached out to me and was like, hey, we've got a lot of parents in our counseling groups, our group sessions that just don't really seem to maybe understand the CPS system. They don't understand what their rights are. So we went in, her and I, and kind of did just a Q&A for parents, showed them, what a safety plan is, what a parental child safety placement is, kind of explained to them what they have, what their rights are, because I think a lot of times parents are afraid to ask questions to their caseworker, thinking, it's going to look like they don't understand or they don't care. So we really wanted to provide a safe space, not to get into case specifics, but really just an overall understanding of the system and what they have the right to ask for, and just what these different what the different paperwork or the different stages of service, what they might entail, what it might look like. And so, initially, our first presentation was a little bumpy when it came to just kind of parents, and they were just in a different stage of their case and kind of new to the group counseling session. So we had to tweak a few things going forward, but ultimately it did end up, we did get really good feedback from parents saying that they did feel like this was a safe space to learn. And a lot of times our parents are still in that maybe that fight or flight mode when their caseworker is talking to them, and their caseworker may have told them the exact same things that we're covering in this Q&A, but they're not able to necessarily process it and really understand it at that time. So that's just some of the ways that we have started relaying it to the staff, but then also to the clients as well.
And I think it's so important because it really takes it back to that piece of centering who we're serving. I can share with Kim and she can share with me, and I can go back and relay to clients. But to be able to put a face, right, to CPS beyond just the worker that was knocking at your door or may have removed your child, right? To be able to build a safe connection and a positive interaction with somebody within the department, right, really helped to, like Kim said, create a situation where they could feel comfortable asking questions, sharing grievances, processing information, right? Which can ultimately lead to more success or at least more understanding within their case, within their interactions with CPS. But it went beyond that by being able to collaborate, again, not just with myself, but with the different departments, right? Not just department leadership, like a program manager, but also with the individual counselors, with the facilitators. It really breaks a barrier to, next time you have a question from a client regarding CPS, right? You have someone to turn to or some frame of reference for that in a deeper way than you may have had before, or vice versa, right? Clients are going to feel more comfortable perhaps taking this information back to their CPS workers, furthering that conversation. So we found that this was very, very pivotal, but then that it also needed to be about troubleshooting. Like Kim said, the first time we tried this, it didn't quite work, and that's okay, right? And that's being willing to, like Kim said, recognize where are the weaknesses or perhaps gaps or lack of understanding, not just in the other party you're working with, right, but within your own agency, your own department, your own self, right? Recognizing kind of those preconceptions or how we thought this would work. Maybe it didn't go to plan, and that's okay, because that created opportunity for dialogue with each other, within the department, within the families, to perfect that, to work on it. And so we have really been able to get to a place of great success with it. And then transferring that over and recognizing it's not just the information being brought into our agency, but how can we bring some of this information back to the department? And so that's where I've had the opportunity, and colleagues of mine have had the opportunity to go out to CPS. We were very intentional. Prior to this, and again, our executive director has worked tirelessly over years and years to really establish a relationship between our agency and the department. And compared to many other places within the region, we've really benefited from this collaboration, but we had to be intentional about how to grow it even more. And so with this creation of the enhanced CPS liaison and the enhanced DV liaison, right? How can we on a regular basis create opportunities for collaboration? This is where Kim was able to brainstorm, hey, what about unit meetings? It happens from time to time, but what if we're really intentional about asking different units to come out, not just to have us come to them, but to actually come out like to our shelter, right? Tour the shelter, being able to see what that looks like, coming out to our Broadway office, being able to see what our non-residential services look like, and host unit meetings there, where we're able to talk not just about agency services, but have real conversations around domestic violence and what that looks like. Lunch and Learns were another great opportunity where we were able to kind of go out over a lunch break, have a captive audience, a broader audience beyond perhaps just a unit, and really share information, bring people from different departments in our agency out, right?
Oh, wow.
And building
So,
these
he was high on
collaborations.
drugs, whatever he was doing, and
Sorry about that. And then additionally, right, quarterly meetings. We want to not just reach, we definitely want to reach people in the field, right? We also really want to work with supervisors, program directors, admins, other individuals, and quarterly meetings were such a great opportunity to capture a very large audience, kind of from the bottom up, the top down, and really meet with everyone and continue this dialogue around how to have better collaboration and how to understand the framework of domestic violence within what CPS does. So again, with these meetings, with these tours, and these opportunities for staff to engage at a more meaningful level, It's definitely something that we've seen benefit for, not just within, ourselves, but within the clients that we serve. Um, and specific kind of example towards that goes to how we're able to bring leadership together to address concerns. Kim mentioned before kind of changes in programming, different policies that may be enacted at a state level that kind of come down and affect what we do and how we provide services, both on the DV and the CPS side, right? Changes to staff. But there's times, right, where we've had situations where, something occurred with a client, right? And I've been able to reach out to Kim, hey, this happened. This is a concern, right? It goes beyond just the caseworker involved. Can we talk at a higher level, right? And bring our executive director and regional directors together to come and start dialogue to create meaningful change.
Yeah, and all of these things are, within your agency, if there's somebody maybe you are struggling to collaborate with or wanting to collaborate with on a deeper level, if you're an organization that can invite them out for a tour, for a unit meeting, or depending on, again, what organization you're trying to collaborate with, again, just having them put eyes on your organization is really helpful. So I know Christina mentioned the tours and like having unit meetings like at their Broadway location. Well, this also helped our staff to see where services are held. So for example, their batterers intervention prevention class is held downstairs while they've got victim services upstairs. And so really, being able to, for the workers to realize like, oh, we need to be mindful in when we are sending them to services, because the bus, it's a shared bus stop right there. So if we have a victim and a perpetrator there at the same time, that could be problematic. But again, they may not understand that without seeing it, where the services are actually held. So just one thing I wanted to mention on that. And then like she mentioned about the leadership. So as a result of our leadership coming together, we realized that, we have a lot of new staff, especially in our investigations division right now. And we do have some basic domestic violence training that they go over in their initial training, but along with many other topics as well. So we realized that our staff need a little bit more in-depth training when it comes to domestic violence. So our regional director was like, yes, let's get all of our investigation staff to go and do a half-a-day training. So Christina and I did seven different trainings with our different programs for child protective investigations, where they came to the shelter for half a day. We talked about the power and control wheel. We talked about the equality wheel. We did some trauma training over some different responses that victims may be having, as well as covering a little bit more about what services are offered at the shelter. What does the shelter look like? And so we did receive some really good feedback on that from our staff, and a lot of things that they did not know. They were given a lot of tools to be able to help clients when they're working with them, to go through with their clients. And some of the other things we've done is that we've been, asked to be a support for domestic violence and CPS liaisons in other regions. So like I mentioned, we did not, we have Bexar County and our family violence shelter have always had a collaborative relationship. However, we have taken it kind of to the next level. But we realized that was not the case in other areas around our region. So, we would go to outlying counties that may have a DV shelter and are trying to work with CPS, and really working through some of those barriers, some of the things, again, that have worked for us, which I feel like has been pretty helpful in some of the areas. We've been able to actually go out to the other shelters, again, just giving them some ideas and some tips on collaboration.
And I think that bringing back to kind of how we were brought together in the first place through Texas Council on Family Violence, like Kim said, we may have perhaps taken for granted to some degree the relationship that the pre-existing relationship here in Bexar County. Yes, with room for growth and improvement, which we're actively working towards, but seeing those differences highlighted as we have been working with people throughout the state, going to statewide trainings where you could draw a line down the room and it's like DV on one side and CPS on the other, while Kim and I are sitting at the table chit-chatting and having just come from breakfast together, right, or something. Just recognizing there are reasons, right, where these divisions have existed. There is a lot of misconceptions. There are a lot of people still feeling like us versus them mentality, right, which not only creates division, right, but it doesn't work to serve, you know, those shared clients that we're with every day. And so being able to go out and see this in other regions, I think has made us even more intentional about why this is important. Kim started off by saying to us, it's like, okay, we could talk about collaboration. It doesn't feel like rocket science to us. And again, we've benefited from people who kind of laid groundwork here for us and did some of this work ahead of time. How can we encourage other people to invest in the time that it takes to do that groundwork, right? And so by being able to represent in Texas virtually, in person at different, specifically the child welfare summits, but in other capacities as well, we really hope to bring this message that our mission is very shared. It's very similar, right? Safety for children, right, results from safety for families. And DV is only one of those components that may, right, be impacting a family, but for where it is intersecting, right, with other things, how can we address that? How can we look at that? Like Kim said, I love how we just keep recentering. For us, this may look like trainings and lunch and learns and tours. In other areas that people are working in other fields, this may look different. What are ways, right, thinking about who you collaborate with, that's what we're hoping, you know, is kind of achieved throughout this presentation, that you're able to kind of take this back to, who do I work with? How have I been intentional? Have I met with these people aside from just over the phone or virtually, right? Do I know where they work? Do I know what side of town they're on? What type of, you know, who is within, you know, not just the face in front of the, you know, representing the agency, right? But who are the facilitators, the people that answer the phones, the maintenance staff, just how does it comprise, right? This entity that I work with, how can I get to know and understand them better, and how can that impact my work? So next slide, please. And I think this is where we wanted to recognize some of those challenges people encounter, some of those barriers, right? Child welfare world, CPS, DV. Again, a lot of focus on things like, we would hear things like, we call, but all we get is we can't confirm or deny. You don't want to partner with us. You don't want to help us, right? Or on the other hand, on our side, we would hear, they, you know, all they want to do, it's punitive. Like, our clients are getting in trouble. They're being required to do this, but the partner, the person choosing violence isn't held accountable, right? So looking at some of the barriers, we're going to kind of discuss those more as we move forward, but we're interested to hear from you. Kim asked in the beginning, what looks like good, how do you know good collaboration? What does it mean to you? But now, as you reflect, what kind of barriers have you encountered when you're trying to collaborate with a community partner? And if you could go ahead and share that out in chat and just share with us. We need to recognize, right, where these barriers or challenges occur, right, in order to be able to build and perfect this collaboration and move it in the right direction.
Absolutely. So we've got miscommunication or misunderstanding. Absolutely. I think that is huge, especially a lot of times nowadays we're communicating via email, and sometimes it may be taken the wrong way than it was sent. You know, I think the same thing happens, you know, with text messages. We don't talk, we're not seeing each other in person as much as we used to. And so there can be a lot of miscommunication or misunderstandings.
Other barriers people have encountered. Definitely, I think communication is probably a common one. Sometimes even just taking that time to communicate, right? Or making that assumption that somebody knows or understands communication. So other challenges people face as they attempt to collaborate. And we can allow time and space for people to kind of go ahead and put this in chat. We can also kind of start sharing from our next slide and then come back and see, you know, if people are kind enough to share more of their thoughts around barriers or challenges. But we'll go ahead to the next slide and then just kind of keep monitoring chat as we go.
And we do have a couple more. So sometimes, you know, and with CPS, they think we're trying to do their job when the reality is we're just hoping to help a parent understand each other's roles and their situation. Yeah, absolutely. And I think personally, that's probably some of the same challenge we have faced within family violence in CPS. And so it kind of goes back to that education piece, ensuring mutual benefit for all parties involved. Yeah.
That's definitely a big one. And then remembering when we talk about parties involved, right, it's not just our agency. It's not just, you know, who we're working for, it's who we're serving. Centering that around what is the benefit, how or what we're doing benefiting them.
Yeah. And we've got another one, partners not talking with clients and having clients sign a release of information in order for agencies to communicate with one another on a client's case. Time as a barrier, absolutely. And that's something we're going to touch on as well. Yes, time is a huge barrier.
And I think too, resources and support, recognizing one of the ways, and I think we're going to touch on this more, Kim and I definitely have had to be intentional about creating time for each other, right? But we also have full caseload, full schedules that are all this stuff we do that's not liaison focused. So being able to come back and really look at an opportunity to, again, bring and involve other people within our agencies, right? Distribute that workload when everyone's building connection, right? Or everyone's having these opportunities, right? It takes the emphasis and focus off just one person. Creating small bits of time for individuals is easier than, you know, huge asks and requests on time from any one person.
Yeah, and these are some of the barriers that we have encountered as well. Time and resources at the bottom there, you can see. Gaps in services, communication, again, being a big one. And like we mentioned, in some areas, there has just been an ongoing friction between DV and CPS. So maybe it's that way with your organization and a partner agency you're trying to work with. It's just kind of always had friction. And so I don't want to say that collaboration has kind of been given up on, but it kind of has. It's like, we're going to work together, you know, get along to go along, but nothing more than that. So breaking, you know, how to get past that friction that's maybe always been there.
And that frustration around turnover, right? You've worked hard, you've built a relationship with somebody. I can't tell you how frequently my staff, at least once or twice a week, they'll get that email back or they'll have had that phone call. So-and-so is leaving CPS. She's the most amazing caseworker. Like, she's the one I know I can turn to. What do I do? Right? It is hard once you've built those relationships and a key person leaves, right? But again, that's why we want to really broaden this opportunity to collaborate so that when one person is no longer there, it doesn't kind of fall apart or get stagnant. We really need those opportunities to build deeper, meaningful collaboration across the board.
Yeah, and that's where, like, an example for us has been, you know, when they are trying to reach a caseworker and maybe they're not there anymore, or the family doesn't know who their caseworker is, getting that, you know, that advocate in contact maybe with the supervisor that oversees that case, or, you know, getting them email addresses, because we do both have to abide by confidentiality, which I think is, for us in the DV CPS world, is a huge reason for the friction between our agencies, because we do both have our confidentiality and not recognizing what those laws are, but then also how to work together to get past that confidentiality. You know, I might not be able to tell you this. However, if a client was at the shelter, these are the things that they may be assigned to do. This would be the curfew, or, you know, so again, how to work past, like, still abiding by your confidentiality laws, but not being like Christina mentioned earlier, sorry, I can't confirm or deny, click. And so how to work past that is something that, again, goes back to that communication piece.
And I think too, just recentering around that idea about perception about what our goals are, recognizing common goals, recognizing too that there may be some goals that aren't shared, right? But from the ones that we are, how do you use that as like a, you know, a starting point? And when you do kind of align yourself, right, then that collaboration does become easier. Looking at time and resources. I think being very vocal and intentional about asking for what you need to do the things that you have to do or that you need to do. Putting the time, the investment in building meaningful collaboration does save on the back end, right? It is going to reduce the amount of time, right, that you're kind of coming in to troubleshoot when something's gone wrong, be it for yourself, be it for a client, right? But it does require support. It does require resources. Going to your supervisors, your program directors, the management, right, and saying, here's what we need to do, and here is why. Here's how it benefits us. What type of time can be allocated? What staff can be allocated to really be intentionally focused on this, right? And it will pay off in the long run. And I think, again, we kind of covered it, but back to that gaps in service, being willing to look at where kind of those holes, those gaps are, and being intentional about focusing. How are we working to address, Kim mentioned, right, the release of information, right, or needing that to respect that confidentiality. Have we trained and educated staff in how to address it with clients, or to address it, right, if another partner agency calls about information? Have we been able to kind of have meaningful communication about these things that we need, so that we are less likely to encounter friction or issues about it?
Absolutely. And moving on to the next slide would be kind of how we got here. I mean, we did not establish this relationship that we have overnight. We didn't just meet and everything kind of fell into place. Like Christina mentioned, it really had to be intentional. We first had to build trust with one another. We started, having lunch once every couple months to, hey, give me some updates, and kind of getting to know each other a little bit more, rather than, again, just that email or that phone call, putting a name to a face and really trying to build that trust. But then also being responsive to the needs. So I feel like that's a huge part when you are trying to build trust with a partner agency, is that being responsive, whether that's to an email, to a phone call, to a request, just so that way they know that they can rely on you. And maybe that response is, I'm not sure, but let me look into it. And then following up with an answer to that question.
I think being open-minded, just recognizing you don't know what you don't know. And we don't know it all, right? Not any one of us, right? So being open-minded to learn from each other, to hear from each other, to really invest that time in understanding why there may be a different perspective on why a policy is the way it is. Even if I don't agree with it, can I understand the reasoning behind? Am I open, right, to hearing other opinions, and to kind of seeing how does that connect with what my understanding is? Does it broaden my perspective at all? Again, not just within the CPS and DV world, but recognizing that we can learn from the people we serve. We learn from the people we work with, from the challenges that we've faced, but also the successes, right? And really bringing them to the table to be able to have a bigger picture of what we're doing in collaboration. I think that also goes a long way back to kind of building trust. When you feel not just that somebody is responsive to you, but really open to hearing you, right? That's where those relationships can really deepen. I know if I've got a concern and I reach out to Kim, I'm not worried with what I say, where it's going to go. I know that's going to be held confidentially. We can have conversations and we'll both agree on where to go next with it, or how, what the outcome from that will be. When I can relay that same trust onto my client, I understand you're concerned about this. I understand, your confidence was broken when somebody shared your location or this or that, right? May I discuss this with my counterpart at CPS, right? Or somebody that she puts me in touch with, because I feel safe in that. So that safety can kind of trickle down, that trust. And then again, establishing those shared goals. I think that we've mentioned this kind of in various capacities throughout this presentation, but again, focusing and centering on where we're trying to go is so important. If we don't have those goals in mind and we're not progressing towards them, right, then really what is our collaboration? Again, that's back to just surface level. We're here to, make the phone call we have to make, do the 9 to 5, right? Check off the boxes, right? Where are we trying to move this, right? What is the goal eventually? All of our actions, all of our words, all of our collaboration should really be focused about moving towards that direction.
And I know that's kind of a mindset I have now. I know working with even other partner agencies, if there's something that I bring up or that a caseworker is questioning me, it's like, okay, well, it's looking for ways now to offer support to maybe that agency, or maybe it's, hey, could you all come in maybe and do a lunch and learn, or come share with our staff about maybe, for example, like what different protective orders look like, or who can file, what's the criteria? So just, again, looking for ways to offer support rather than just identifying those barriers or those issues. Okay, well, I understand. So I've gotten a lot of questions around this. So maybe it's time to do some type of training or, some type of broadcast or whatever the case is, rather than just identifying the gaps there. But also being intentional about it. I know Christina's mentioned this a few times. There'll be times now where sometimes we do kind of take this relationship for granted. And it's like, hey, I need to check in with Christina and see what's going on at the shelter. Have there been any, common trends going on with CPS or with family violence we need to know about? This was really important too, like during COVID. When COVID first started, there were so many changes on both sides. And so making sure that we are both informed about the changes in each other's organizations.
Absolutely. I think one of my first thoughts the day that we got sent home from, back in March of 2020 was, I need to talk to Kim, right? Like we are still just, it's like up in the air. Are services in person? Are they not? Are they canceled? Are they virtual? Are they this? How do we do this? Can I share this information? Can I have her help broadcast it out, right? And sometimes it can almost even feel like getting over that feeling of like, oh, am I asking too much, or am I bothering this person? I trust, right, this relationship of knowing that that she also values, like, yes, it's not just important for you. You're not just doing this on behalf of your clients, right? But how is this benefiting everyone within CPS who has to understand how this is going to impact services their clients are doing, or how they're going to be able to engage, in an appropriate way. So being able to constantly just check in, again, expanding to include other people. I can think of amazing collaborations, aside from just Kim, workers who have, the first time I visited Child Save, it was at the request of a CPS worker, right? Can you come with us? I'm going to be there, but I know the client is still very hesitant, right? Having these opportunities to just kind of work and look at all of the other ways, all of the other agencies that we interface with, right? Beyond just CPS, beyond just domestic violence and family violence prevention services. Having those introductions and kind of building that networking out and capitalizing on the relationships Kim may have, or that I may have, vice versa, to be able to connect people. When Kim, I think about the time that she got a huge shipment of, it was underwear, right? Kids' underwear. It sounds silly, right? One of the biggest needs at our donation center, right? People turn in clothes, people, share, household items, right? But our kids need, new, clean, fresh underwear. And having her give us like these boxes, they had received them, they had provided them, they had a surplus. She shared that on with us, not just at our donation center, but when we put it out kind of in a shared area for people to take. Oh my gosh, gone in an instant, because it was such a need, something that we didn't necessarily have access to, but just through her contacts, right? Being able to benefit from that as well. So amazing to be able to create those connections across a broader front within the community.
Yeah, and something that we forgot to mention too. So when we did the half-a-day training at the shelter specific on domestic violence, Christina also brought in family violence staff to sit at each of the tables within the training, so that again, those caseworkers could have another face for family violence, build those relationships, and vice versa. So we incorporated, not only our staff, but also the family violence staff. And so I would just encourage you going forward in regards to collaboration is to find that one person you can start that relationship with and grow that, and then look to expand it, so that way you're not overwhelmed with, oh my gosh, there's so many people in these different organizations, and just starting with the one, building that connection, building that relationship, and then slowly being able to bring in, maybe it's leadership to start with, and then expanding to other, other staff within the agency.
And then really, again, checking that bias or perception that you may hold, you may not even be aware that you hold. We had faith-based community come out, or representatives from a faith-based community come out to one of our trainings. Didn't know they were coming. Very glad to have them there. But we were doing an activity called In Her Shoes. And in this activity, right, we were inviting CPS and FEPS staff to kind of walk through the mind of a survivor as they're trying to access different services and navigate support while they're experiencing violence in a relationship. One of those services they're trying to access, right, is through faith-based support, right, through their church, and recognizing the group that had our representatives from a local community church happened to be given, were in the group of the survivor that they were making decisions as, who was trying to access support from their church, and their church was unreceptive. In fact, their church kind of made recommendations, very well intentioned, that actually kind of put that survivor at more risk. And so being able to have these conversations and look, right, again, critically at ourselves and our responses, not just the ways like, oh, well, they won't want to participate, right, because this might be offensive to them, or they may not think that it is relevant to them. But what amazing conversation we were able to have around that, and to be able to see the different perspectives and how supportive faith-based response can be, right? Or response when it comes to someone, engaged in substance abuse treatment, or other ways that we intersect, just bringing everyone to the table, right, as we collaborate to have more meaningful depth to that collaboration.
Next slide, please. And I think now it is just, if anybody has any questions, any discussion, you're welcome to come off mute as well, or if you want to put it in the chat, just kind of want to open it up.
And just kind of going back to chat here as well. We would love DV agency and CPS representation and DSHS led discussions on how we can prevent more increases linked to women, to respectful, timely prenatal care. Absolutely, so important as we look at domestic violence being, when we look at risk to lethality and we look at women who are experiencing violence, #1 cause of death during pregnancy, right, at the hands of an intimate partner. So absolutely another great opportunity to collaborate, and looking at that role, who, when there's something within the medical field and there's something been disclosed, right, looking at mandated reporters, and they're reaching out to CPS because there may be children, right, in danger, and how can we collaborate from the DV world as well to kind of prepare CPS for kind of those responses, and how can we collaborate on seeking safety for these families.
Any other questions or comments? Thoughts?
I see Trala represented. Again, I think across the board, all of our shared clients, the need for legal advocacy, for representation, for support at that intersection with CPS, with domestic violence, with all of our varied agencies. So important to recognize the very critical role of representation and legal support. Anyone have any comments on collaborations that have gone especially well? Anybody that wants to shout out a community partner that they just really value or they thank them for their efforts in collaboration? There have to be other people who are having phenomenal collaboration, and we would love to hear about that and just really end like with on that energetic note of, you know, how positive this can be.
I'm jumping in to respond to your questions since I have microphone access and other people can type their responses. That would give them a minute to do that. So I used to work at the Health and Human Services Commission in the mental health area and provided technical assistance for community resource coordination groups. There is one in Bexar County focused on children, and there are some in virtually every county in Texas. They are charged with helping staff and resolve cases with complex mental health and other needs, situations where one agency can't meet the need for a particular either child or adult, depending on what the group focuses on. I'll put a link in the chat on where you can look up the respective group for your area. In Bexar County, CPS actually runs the group and it's focused on kids only. There's not an adult group in Bexar County, which would be super beneficial. But what's really successful about these groups is that they're voluntary collaboratives, basically, of anywhere from 10 to 20 local and regional offices of government and community organizations. They come to a group staffing, they listen to the concerns and situations and figure out where they can fill the gaps when they work together. It's really interesting and successful and largely a voluntary process. And it looks like you do have some responses now in the chat that we can look at.
I see 18 years ago, I used to work with the AIDS Outreach Center in Fort Worth. We used to have monthly meetings with local agencies that serve persons with HIV/AIDS, and we would discuss issues clients were experiencing and how to better serve and connect those clients with resources in the area. Another phenomenal example, right, of just bringing people to the table monthly, right? Kim mentioned sometimes we're getting together, sometimes we realize, oh, it's been several months. Even if you can carve out that time, 1 hour a month, right, to just sit down. And then back to that idea of time, I think another important idea to mention might be how are we incorporating not just our staff, but like volunteers and interns. Interns who are there to learn, but who are going to grow on to be part of this community and in various different capacities, right? And then one day that knowledge that they've gained, right, really may benefit. So being able to involve them in that, I think is so important. Oh, and I think Kim's getting a shout out. Yay.
Oh.
I'd like to thank Ms. Hill for her great collaboration with our agency, FJC. Thank you for always responding to our emails and assisting us in order to expedite our protective orders.
Thank you. Awesome. Well, thank everybody so much just for jumping on. You're welcome to, I know you've got a copy of the presentation. Our emails are on the last slide there. You know, if you need to reach either one of us or have any other questions that come up, we're happy to answer any of those.
Absolutely. Thank you so much for your time this morning and for everyone's, you know, collective contributions to our community, to the shared clients that we all serve, and just for being here as part of the conversation in our presentation and in all the other presentations yesterday and today. We appreciate all of you.
Thank you so much, Christina and Kim, for joining us. A reminder to folks, you have a 15-minute break now, and at 10:15 we'll convene as the full audience for a single session again. Thank you so much, Christina and Kim, for being with us. Have a good day.
Thank you.